Now we'll talk about how the denture can be maintained and how it can sit and how it can be stabilized. Those elements for sitting, stabilizing, and maintenance of the denture on the prosthetic field in the mouth is ensured partly by the clasps. Now, we see the clasp that we regularly use. On the mesial, on the first quadrant, this goes from the cervical region. It is open dentally, that means the free part goes to the dentulous region, to the teeth, and on the other side also it's open to the teeth, so both clasps give maintenance and stability but not rest. In this second quadrant, which is recommended for terminal edentations, we use this type of clasp, which is cervical occlusal opened edentulously. That means towards the edentulous zone. This needs the two teeth, at least two teeth, because its intermediate segment goes in between those two teeth in the masticatory niche or embrasure. And that also gives not only maintenance, stability, but also rest for the denture. That means prevents the denture from going into the mucosa. The clasps are quite simple. Normally the doctor decides that, or maybe the technician can use the parallelometer to determine exactly the best position of the clasps, especially in case of malpositions of the migrated teeth, right, horizontally or vertical migrations. And those malpositions, they increase the difficulty level for determining the best insertion axis of the denture, because we have to take into account the whole equator, the common equator of all the teeth. That's the prosthetic equator. Now, in our case, the equator is quite the same because the teeth are quite parallel. There's no malposition of the teeth. So this equator, as you can see, divides the labial side of the teeth in one zone which is subequatorial and the other supra-over epi-equatorial. The clasp will go with a free part under the equator in order to be able to retain the denture. So the clasp is not to be placed no matter where. They have to be in contact, intimate contact with the tooth in 2/3 of the surface. As we said, the free part occupies 2/3 of the labial side of the tooth. The tip has to be rounded in order to avoid lesions to the mucosa or to create scratches in the enamel of the tooth. Now again, this is a real wire that we're using. So let's start with this first clasp. Cervico-occlusal, open dentally. We use this plier. So it has a rounded side and a flat side. The rounded side has also a hole that allows us to introduce the wire, and it's there where you can cut it, right? That's how you cut it. Now we start with the dental segment. The clasps are in 3 segments, right? Come in 3 segments: dental, intermediate, and retentive, the one that goes into the denture base. The round part of this is used for slowly bending the wire. The wire that I left longer on purpose in order to make it more comfortable for me to hold it. And I start creating a rounded zone as smooth as possible. I don't try to use force upon the wire. It has to be bent only in one direction. Don't bend and rebend it and bend and rebend it. It will crack if you do that. So I cut the length as to fit in the drawing that I've done on the model. So again, don't bend and rebend it again, because you diminish the resistance, the strength of the metal. So now I just mark where I want to bend it once the labial side is kind of ready. Where the mark is where the free and intermediate segments merge. So the intermediate segment is in U or in V shape. I would like to have a V segment, so I'll use the flat side of the plier. I take care to make it very clear where it has to sit, to know exactly how and where I have to bend. So I keep the plan. If I modify it all the time, I will not know how to bend it, yeah? So again, the technician, you see, places the wire there, keeps the position, holds it in place, yeah, with the plier very firmly, and then it's very firmly placed, you see, in the plier, and then creates the bending. That's it, bum. That's the first bending. First bending that allows me to appreciate. I didn't do it thoroughly, fully. It was just to see if it's correct. Yes, it is correct. It has to be positioned under the marginal crest, distal in our case. It will not interfere in occlusion. It will be away from it. And now that technician knows that it is correct, he continues to bend slowly. I repeat the operation. I place it back because it moved in my hand. I better check more times than to bend it and rebend it and have to do another one. So this is kind of wet painting. It's not a pen, it's not a regular pen, because I want to have very clear insight of what I have to do. So I keep my plan again and I bend it. I bend it again. Keep bending it slowly. So this seems to sit well. Now I have to cut the wire because it touches the palatal side of the model. So the wire goes into the hole up there, you saw it. I keep both of sides of the wire, because otherwise it may fall and I don't want to look for it in the lab. Right. So I check the position again. As you can see, the free part is in contact with the tooth nicely. I never force the wire. I don't press it on the model because I may modify the model. I want to keep the model as clean and exact as possible. Because if I create big scratches or things like that, then it will be different from the reality in the mouth of the patient. I bend the wire so as to keep contact with the proximal side of our tooth. I don't want it to be far from that proximal side, distal in our case. It's not that easy. You have to do it with care, with caution. I try to be as attentive as possible and to avoid damaging the wire when I press it with the plier. So this is where I'll finish bending the intermediate segment. As you can see, it's not one plan, it's multi-plan. So it's really 3D. It has to follow exactly the shape, the structure of the outer structure of the tooth. So I place the intermediate segment on the tooth, and this is very important. Also because it will prevent lateral movements of the denture. So that's why we cannot place it no matter where, no matter how. And now the retentive segment will be created, will be fathomed. It has to be placed, it will be placed in the base of the denture, the acrylic denture base, which regularly is pink acrylic. I don't want to place it at the crest level because it may hinder me to place the artificial teeth on that part of the crest. I won't go too much on the palatal, because there the material can be thinner in order to give more freedom for the tongue of the patient. So I rather place it away from the teeth place, but still close to the crest where there's a lot of material thickness. Material means the acrylic resin. Yeah, the pink base of the denture, which normally has around 2 millimeters. The wire is like 0.7 in this case, so we know that there will be enough resin above and upon it and under it. We'll have like 0.6 if we really place in the middle. On each side, I mean. 2 minus 0.7 divided by 2. Now, the retentive part follows the profile of the labial, of the edentulous crest. The wire doesn't touch the gum at all. It only touches the labial surface of the teeth. Has nothing to do with the marginal periodontium or the mucosa that covers the crests or the palate. To ensure retention, I grab the margin of the wire with a plier. I hold it well into position so as to prevent movements, right? And then I rotate the plier around the wire so as to get a curve. I can use the hole up there in order to extra bend it just by pressing it together or against the other part of the clasp. when we work at different segments of the clasp, we may modify a little bit the shape of the other segments. So that's why we finalize this shape of the active segment only now. Yeah, we do the final touches now. And this will always be the case, that in the end you will have to adjust a little bit here and there. And I'm using the rounded part of the clasp. I don't want to have the wire bend in segments, but in one nice smooth curve, right? At the same time, the tip should not be long, should not prematurely come in contact with the tooth. That means point to the tooth. It has to be strictly parallel to it, to the surface of the tooth. It has to be shortened a little bit. Yeah, we always use a little bit longer wires and then we shorten as needed. So we don't want the retentive part, the third part, to touch the crest. That's why we rebend it. And yes, at the end, they will have to be placed there in position with some dots of wax. We won't be able to keep it by hand, obviously. So this is the clasp that we wanted to create. Cervical occlusal, open dentally. So the spatula should pass under it to make sure that there is enough space for the acrylic resin to get there under the clasp. And at the end, I'm just making the tip round with a slightly abrasive polisher to avoid undesired scratches on the enamel or lesions to the mucosa. Thank you.